Hi, I'm Dr. Anna Catherine Black, a licensed clinical psychologist at GI Psychology. I'm excited to talk to you today about psychological treatments for gastrointestinal disorders and ways in which GI psychology can help you on your path towards relief. GI psychology is a fully telehealth national practice. We see patients as young as age 6 and sometimes younger when appropriate, and all the way up to older adults. We have providers that can see patients in all 50 states, including Washington, D.C. Our one of a kind practice is focused on being a resource to gastroenterologists and patients just like you across the country. We provide empirically backed gut brain therapy for patients with disorders of gut brain interaction, inflammatory bowel disease, as well as chronic pain and other medically complex conditions. All of us at GI Psychology value partnering with GI practices across the nation to increase access to care and help improve holistic care for patients with GI conditions. Some of our largest partnerships include the American College of Gastroenterology, the Crohn's and Colitis Foundation, MedStar Georgetown University Hospital, Scripps, and the Mayo Clinic in Jacksonville. And there's so many more. We're actively working to build partnerships across the country. Now, to better understand how a gut brain therapist can support you with your GI concerns, let's talk a little bit more about the gut brain axis and how this can lead to a DGBI, or disorder of the gut brain interaction. Our brain and our gut are constantly in communication, and we do this communicating through our nervous systems. There's the central nervous system, which includes the brain and the spinal cord, and the enteric nervous system, which is located in our gut. These are things that can't be seen in lab work or on scopes. As I said, our brain and gut are constantly in communication back and forth. And when the system's working the way it's supposed to, it lets us know when it's time to eat, when we're full, or when there's something problematic in our stomach, like maybe we've eaten something we're not supposed to, or we have a virus. This communication system can become faulty for many reasons, like genetics, an infection, chronic stressful life events, or even constipation and diarrhea. As a result, our brain is more reactive to and distorts normal signals in the gut, resulting in an experience of increased pain and discomfort. This is called visceral hypersensitivity, which, together with our brain constantly scanning for gut related issues, also known as hypervigilance, that results in a vicious cycle of pain and worry, potentially causing a disorder of the gut brain interaction, or DGBI. The two research supported treatments we use at GI Psychology are cognitive behavioral therapy for GI and gut focused clinical hypnosis. Now, when we think about hypnosis, it's important to distinguish between the two kinds. There's entertainment hypnosis, and then there's clinical hypnosis. Unfortunately, most of us are more aware of the entertainment hypnosis, which is what you think about when you think about somebody on stage doing something embarrassing like quacking like a duck. Clinical hypnosis is very different. For this, you go into trance on purpose, not accidentally. And trance is just simply a combination of concentration and imagination. It's actually something that happens naturally all the time, and you've probably already experienced it if you've ever been scrolling on your phone, or you've gotten lost in a good book or movie, or maybe when you've been traveling to work. During this trance, your therapist uses suggestions which are targeted to address your concerns. What's important to note is that you're in complete control when you're in trance, and you would never be asked to do anything that you don't want to do or wouldn't do outside of trance. In fact, many people actually report feeling more in control because they decide what they want to do or what not to do based on those suggestions. Each person has a different level of hypnotic talent, which simply means how easily they fall into trance. However, most people have enough hypnotic talent to participate in hypnosis. You don't actually have to be an expert or a master in order to get benefit. There are years of research to support these treatments for DGBIs. In fact, these treatment approaches are backed by the Rome Foundation and the American College of Gastroenterology clinical guidelines. Through our practice, we have helped hundreds of patients just like you. In fact, 8 out of every 10 patients reaches their treatment goals, and you can be one of those people. GI Psychology is an out of network provider, which means we don't take insurances, but we do provide super bills on a regular basis. Super bills may be reimbursed using your out of network mental health benefits specifically for commercial insurances. So we don't include Medicaid and Medicare. In terms of cost for treatment, we typically find that if someone's coming in for a GI specific concern only, they would typically require about 13 sessions on average, although this can vary depending on the variety of concerns that you might want to work on. We have the flexibility as therapists to make sure that you're getting exactly what you need to meet your treatment goals. The intake appointment costs $325 and it's $250 for each subsequent appointment. We do have a few lower cost options, including a 4-week GI skills workshop where you'll learn more about the gut brain interaction, as well as some foundational coping skills for living with a GI condition. And you'll also have the opportunity to engage in some experiential exercises. We also support patients with obtaining a single case agreement or gap exception with your commercial insurance if that's helpful for you and you choose to go that route. So, with the support of our admin team, we would help you seek out that single case agreement through your insurance, where our services would be covered as if we were in network on a reimbursement basis. And lastly, here's the best way to get in touch with us at GI Psychology. At the top is our email address, our admin phone number, and email address. And I've also included a QR code for our Contact Us form. You can sign up for a free 15-minute phone consultation where you'll meet with a member of our admin team to talk a little bit more about your concerns and what you're looking for out of treatment. And then you can decide if GI Psychology is the right fit for you. We as a team really look forward to meeting you and figuring out how we can help you experience relief and be on that road to recovery. Take care.